Hi, this is Rich Branson, Editor-in-Chief of Respiratory Care. In this YouTube video, we're having an author interview with Dr. Neil MacIntyre from Duke University. Neil, thanks for joining us today.
Glad to be here, Rich.
In the June issue of Respiratory Care is the results of the journal conference on pulmonary rehabilitation. It's a very important topic, very interesting for respiratory therapists, physicians, and nurses alike. So Neil, as part of this conference where I learned a lot, one of the questions is, what's the evidence for pulmonary rehabilitation in patients with COPD?
Actually, Rich, the evidence base supporting it, pulmonary rehabilitation and chronic lung disease, especially COPD, is incredibly strong. It has accumulated over the last half century, and as I say, is quite extensive. I found it very interesting that the Cochrane Review group a couple of years ago, I can't remember when, actually did made an unprecedented move in that they said, please stop sending us trials that show pulmonary rehabilitation works. We've got enough. Go focus on other aspects of pulmonary rehab other than the fact that it works. I don't think I've ever seen that from the Cochrane database group before. Obviously, I could be wrong, but I thought that was an incredibly strong statement that says that this concept of rehab, exercise, education, psychosocial support really does impact meaningful clinical outcomes in patients with chronic lung disease, especially those with COPD.
Again, Neil, this is a new area for me, spending most of my life doing critical care. I was overwhelmed by that data, followed by the just infinitesimal number of people who get referred for pulmonary rehab, and the even smaller number of people who, after referral, actually go on to attend a program. Why is that?
Well, pulmonary rehab is not an on-off switch. It takes time. It's actually, if you think about it, a lifestyle adjustment. It is not a simple pill, if you will, that you take. It requires time. It requires effort. It requires cooperation. It requires, I like the term buy-in from the patient, that this is a meaningful program exercise to go through, and that it's worth the time, money, and energy you're being asked to spend on it. So it's not a simple procedure. It again involves time, and it involves, really, as I say, a lifestyle change on the part of the patient. Having said all that, there are significant barriers. First off, there are not a lot of centers that do it. Jill Ohar published some nice data not too long ago showing that the distance between patients with COPD and rehab centers across the United States is quite long, quite large, especially in non-urban settings. So distances to centers is a problem. That means issues with transportation, issues, with caregivers helping out, issues with transporting oxygen, and just overall logistics of getting there when these centers are few and far between. There's an issue of pulmonary rehab that I don't think is talked about. And fortunately, at our conference, we had a couple of discussions about it, and that is patient buy-in. I mentioned that term before. I'm going to reemphasize it here. Patients really have to want to do it. They really have to want to do it, and they have to be willing to commit, and they have to be willing to make a lifestyle change to follow the full tenets of pulmonary rehabilitation. And to me, even though logistics and transportation and costs, et cetera, are important, I think patient buy-in, to me, is one of the most important barriers to pulmonary rehab. And to address that, we as a medical community, respiratory therapists, doctors, nurses, everybody, need to reinforce that to these kinds of patients that chronic lung disease can be managed and the quality of life can be greatly improved if you embrace the tenets of, and I'm going to emphasize the word comprehensive pulmonary rehabilitation.
I think all of us can appreciate that, right? It's no different than trying to adhere to an exercise routine ourselves or a weight loss routine ourselves. But yeah, I was just, again, for a therapy that's overwhelmingly positive, for so few people to participate, I guess says a lot.
Yeah, it's I remember one of the presentations, I'm blocking which one it was, but one of the presentations spent a lot of time saying that the therapists and the caregivers in a rehab program really need more formal education on strategies to affect lifestyle changes.
Yeah, Dr. Benzo's
Thank
whole
you. Yes,
talk, yeah,
yes.
was mostly about how do you get people to make a change in their lifestyle. So I warned you these are short. Going forward, can you give us some like really important aspects of research that need to be done on pulmonary rehab?
I think there's a big push on getting tele-rehab. That is putting rehab opportunities and access to rehab programs online or through some other medium that goes into the home. And I think on the surface, these sound really important. And I would certainly encourage research as to how to develop these programs to make them as user-friendly and effective as possible. Unfortunately, I'm afraid going into the home, while attractive, is never, I'm afraid, going to be as good as going to a real center with real people and real therapists who are doing real things with you. But research to make that home experience as good as a center-based rehab program, I think, are really critically important. I also think understanding exercise is important. What are the best exercises to give? I remember Michael Bellman told me years ago the best exercise for a chronic lung disease patient is the exercise that he or she will do. And I think that's pretty sound advice. Having said that, I think there are ways to make the exercise experience better for patients. And finally, we touched on this with the last question, but I think real research needs to be done in the behavioral sciences as to how to get patients to, I'll use the word again, buy in to the concept of lifestyle change and pulmonary rehabilitation.
Okay, great, Neil. I really appreciate you taking some time out of your schedule today. And we
Happy to
look
do it.
forward to seeing the entire journal conference on pulmonary rehab.
I'm looking forward to it too. Thanks.
Thank you.